The Vanderbilt program for LGBTI health started in 2011 with the planning stages going back to 2010, and we recognized that at our academic medical center we had opportunities to improve the way that we delivered content to our trainees in the area of LGBTI health and clinical services to the patients in the LGBTI community that were coming to our hospital for clinical services. And for that reason, we decided to launch the Vanderbilt program for LGBTI health.
The type of work that we had been doing before the LGBTI, I think it is, program here in the medical center revolved around research, in my case, research into lesbian health and obesity. And probably more than work, what led to the formation of it was the questions that all of us who are out get on a daily basis about physicians and other healthcare providers who are friendly and that we would recommend. How it has sort of evolved from that is that, and I think probably the most important program that the center offers is the Trans Buddy program.
A buddy is basically someone who does patient advocacy, who provides emotional support to trans people, who basically helps trans folks navigate the healthcare system. Trans Buddy started as an idea from a trans person who was really looking at the gaps of care available to trans people here in Nashville, Tennessee. And having observed that gap and experienced the misgendering and experiencing the discrimination in multiple different healthcare settings, Kale Edmondson, the co-founder of the Trans Buddy program, decided that enough is enough and that something needs to change. And what the Trans Buddy program does is to remind people that when it comes to the trans community, you really have to take a trans patient-centered approach to the work that you're providing and to the access, the kinds of forms of healthcare that medical professionals are providing to trans patients specifically, and that's going to really have a positive impact on that patient's life.
In the 6 years that the program has been in existence, we've accomplished a tremendous amount. We have the nation's first transgender patient-specific navigator program that pairs transgender patients with community volunteers to help them navigate the healthcare system. We have launched a number of online training and in-person training opportunities for our clinical staff, and we've become a leader in a training paradigm that we're hoping to roll out across the country. We've published a textbook that's widely used across the country and internationally on LGBTI health, and we've helped develop research protocols, research studies, and published a number of papers that are defining the best way to provide care for LGBTI patients.
We have to be about looking at and tending to all those groups that have health disparities. And there's not one with a stronger record of health disparities for all the age groups involved in the LGBT patient base. So it became very clear with the work of Jesse Ehrenfeld as well as Kristen Ekstrand that we needed to address that and make that part of our global diversity and inclusion tent.
I think the main thing that has surprised me in my work here is to learn more about the unique health disparities that LGBT people face and the structural stigma that exists that creates some of these disparities. It's been really eye-opening to learn more about particularly the rates of mental health disparities, the fact that LGBT people are more susceptible to anxiety and depression and interpersonal violence. And it's actually really fueled a passion in me to want to educate our community even more on the unique challenges that we face as a community, and to help people get healthy and make sure that vulnerable people get the health care that they need.
It is important as a moral mission for us to look at and try to achieve health for all groups, and certainly those groups that are discriminated against or suffer health disparities, such as our LGBT patient group. We can't be a moral, committed university to serving all of the patients that are part of our catchment area here in Middle Tennessee if we don't address the problems of that very unique group.
So what's next for the Vanderbilt program? Well, we have a lot to do. We still have a big gap between the knowledge base of many of our providers out in the community and what the current state of practice is for LGBTI patients. We still have lots of people in the LGBTI community who struggle to access care and services, and so we're working to bridge that gap to make care more accessible through the various networks and interactions that we have out in the community. And finally, we know that there's a lot more research to be done to define the best way to take care of LGBTI individuals, and we're hoping to continue to lead that in the future.